But there is a less common and more serious cause of yellow nails, a condition called yellow nail syndrome. In this syndrome, nails grow extremely slowly, turn yellowish green, and because here's something that most people are never told, and honestly, most doctors don't even explain this properly. Your fingernails are not growing from dead cells. They are being manufactured right now, this second, by one of the most metabolically active tissue systems in your entire body. And that system, it is connected to your heart, your liver, your kidneys, your gut, your brain. So when something goes wrong, deep inside, where you can't see it, where you can't feel it yet, the nails begin to change. Not overnight, quietly, slowly, in ways that most people ignore for months, sometimes years, and then one day sit in a hospital room wondering, how did I miss this? I'm going to show you exactly what to look for today. My name is Dr. Leonard. I've spent the last 19 years working in internal and integrative medicine, and I want to be very honest with you from the start. This video is not about scaring you. It is about giving you a tool, a free zero equipment, do it right now tool that your body has been offering you this entire time. We're going to go through 9 nail signs today. Some of them are common, some of them are rare but critical, and the last one, sign number 1, I have deliberately saved for 1. I have deliberately saved for the end, because it is the one that I believe could genuinely change the course of someone's life who is watching this today. So stay with me, let's start. Before we get into the signs, I want you to understand why this works. Because once you understand the mechanism, the signs stop feeling like superstition and start feeling like science. Here's what's happening under your cuticle right now. Your nails grow from a structure called the nail matrix, a crescent-shaped band of rapidly dividing cells tucked just beneath the skin at the base of each nail. These cells divide faster than almost any other tissue in your body. That speed requires a constant, high-quality supply of oxygen, nutrients, and hormonal signals. Think of your nail matrix like a very sensitive printer. When the ink supply is rich, the paper is smooth, the output is even and clean. But the moment something disrupts that supply, whether it's a drop in iron, a hormonal imbalance, a toxin building up in the blood, or reduced oxygen, the printer starts producing flawed output. Lines, dents, discoloration, shape changes, and because nails grow at roughly 3 millimeters per month, they essentially carry a time-stamped record of what your body was dealing with weeks and months ago. That groove crossing your nail halfway down, that may be recording something that happened to your body 4 months ago. That pale patch at the base, that could be reflecting what's happening in your bloodstream right now. This is not alternative medicine. This is onychology, the clinical study of nails, and it is used by rheumatologists, cardiologists, and dermatologists every single day. The problem is that nobody teaches you to read it. Until today. Let's start with the sign that the most number of people watching this video are going to recognize immediately, and have been dismissing for years. Your nails are soft, they bend, they peel in layers, they tear when you open a bag of chips or type too aggressively on a keyboard, and you've told yourself, it's just how my nails are. But here's what soft, thin, peeling nails are actually trying to communicate. Your body may be running low on biotin, which is vitamin B7, or on silica, which is a trace mineral that most people have never even heard of. Silica is the structural mineral. It is to your nails, skin, and hair what steel reinforcement is to concrete. Without it, the structure becomes soft, flexible, and prone to breaking. The secondary cause of this, and this is the one I really want you to pay attention to, is low stomach acid. Now, most people, when they hear stomach problems, they think of heartburn or bloating, but low stomach acid is a silent condition. You often feel nothing. What's happening, though, is that your stomach is no longer properly breaking down and extracting minerals from the food you eat. So even if you're eating a reasonably balanced diet, your body is not actually absorbing what it needs. And the nails, they're one of the first places this shows up. After the age of 50, stomach acid production begins to decline naturally. If you are also taking proton pump inhibitors, the acid-blocking medications commonly prescribed for reflux, this problem compounds significantly. What to do? Ask your doctor to check your B7, silica, and ferritin levels. If you are on long-term acid suppressants, have a conversation with your doctor about whether your mineral absorption has been assessed. A simple dietary addition, pumpkin seeds, Brazil nuts, and whole oats, can meaningfully support silica levels over time. Yellow nails. Most people blame nail polish, and sometimes, yes, that's all it is. Years of dark-colored lacquer can leave a stain, and that's cosmetic and harmless. But if your nails have turned yellow and you haven't worn nail polish in weeks, or if the yellow is getting thicker, slower growing, and harder to scrape off, your body is telling a different story. The most common cause is a fungal infection of the nail bed. The fungus lives underneath the nail plate, feeding on keratin, causing the nail to thicken, crumble, and turn from yellow to brown to sometimes black at the edges. This is not just cosmetic. If you have diabetes, even a small fungal nail infection can become a serious entry point for bacteria. It needs to be treated. But there is a less common and more serious cause of yellow nails, a condition called yellow nail syndrome. In this syndrome, nails grow extremely slowly, turn yellowish-green, and may begin to curve, and it is associated with two things that most people would never connect to their fingernails: chronic lung disease and lymphedema, which is a condition where fluid builds up in the tissues of the limbs. The lung connection makes biological sense. Your nails need oxygen-rich blood to grow properly and to maintain their color. When the lungs are not delivering full oxygen capacity to the body, the nail beds are among the first tissues to show the impact, through discoloration and slowed growth. What to do? If your yellow nails are accompanied by a persistent cough, unusual shortness of breath, or swelling in the legs or feet, mention all three to your doctor together. That combination paints a picture worth investigating. Now I want you to do something right now. Run your fingertip across the surface of your thumbnail from the base toward the tip. Do you feel a ridge, a groove, a little dip, like someone pressed a line across the nail? Those are called Beau's lines, and they are one of the most informative signs in all of nail medicine. Here's what they mean. At some point in the past, weeks or months ago, depending on where the groove sits on your nail matrix stopped producing nail tissue normally. It slowed dramatically, then it recovered and started again. The groove is the scar of that interruption. A single Beau's line across several fingers at the same time almost always means the body went through a significant systemic stress, a high fever, a serious infection, major surgery, or a severe nutritional crash. If you had COVID-19 in the past couple of years and you're seeing a groove, that is almost certainly what you're looking at. But here's the part I need you to pay close attention to. Multiple grooves, recurring grooves. Grooves that keep appearing without any obvious illness to explain them. Those are a different signal entirely. Repeated Beau's lines have a documented association with chronic kidney disease and uncontrolled diabetes, both of which create internal metabolic disruptions that are toxic to the rapidly dividing cells of the nail matrix, even when you feel nothing outwardly. Chronic kidney disease affects a massive percentage of adults over 55, and in its early stages, it is almost entirely invisible. No pain, no dramatic symptoms, just quiet, progressive damage, and some of those people have been watching grooves appear on their nails for 2 or 3 years and calling it nothing. What to do? If you find more than one groove, or if the grooves keep returning, ask your doctor for a basic metabolic panel: creatinine, eGFR, and blood glucose. These are simple blood tests that can reveal kidney and metabolic health. Early-stage kidney disease, caught early, can be managed. Late-stage kidney disease is a different conversation entirely. This one is quick but important. Look at your nails under direct light. Do you see small dents? Tiny craters, like someone pressed a pin lightly into the surface in multiple spots? These are called nail pits, and they are one of the strongest nail signals in medicine because they have a very specific association with psoriasis and psoriatic arthritis. Here's something that surprises most people. Psoriasis is not a skin disease. It is an immune system disease that expresses itself on the skin, and in many people it first appears not as red scaly patches, but as pitting on the nails, sometimes years before any skin involvement appears. More importantly, nail pitting in adults can be the key clue that what is being called regular arthritis is actually psoriatic arthritis, a different condition with different treatments. Many people are living with psoriatic arthritis, having been told they simply have wear and tear arthritis because nobody connected the dots between their joint pain and the pitting on their nails. What to do? If you have nail pitting, especially combined with joint stiffness, pain in the fingers or toes, or any patches of dry, flaky skin, bring it up with your doctor specifically. Ask the words, "Could this be psoriatic arthritis?" That one question may redirect your entire treatment approach. This one is rarer, but when it's present, it matters enormously. Look at your fingertips from the side. In a normal hand, there is a clear angle between the nail and the skin at the cuticle. The nail sits flat or curves gently. The fingertip itself is not enlarged. In clubbing, that angle disappears. The fingertip begins to bulge outward like a small drumstick. The nail curves over the edge of the fingertip like it's wrapping around it. The whole finger looks rounder, puffier at the end than it used to. This is called digital clubbing, and it is almost always a sign that the body has been dealing with chronically low oxygen for a significant period of time. The body responds by sending extra blood flow to the fingertips. The tissue swells, and the nail gradually reshapes itself around that swelling. The underlying causes include chronic lung conditions, COPD, pulmonary fibrosis, chronic bronchiectasis, congenital heart defects, and in some cases, inflammatory bowel disease or liver cirrhosis. This does not happen overnight, it builds over months and years, which means that by the time someone notices it, something has been quietly progressing for a long time. What to do? If you notice your fingertips look significantly rounder than they used to, and the nail appears to wrap over the edge, show your doctor at your next visit. Do not wait. Ask for a lung function assessment and an oxygen saturation check. These are completely non-invasive tests and take minutes. Most nails curve gently downward, but in some people the nail does the opposite. The edges lift upward and the center of the nail dips, forming a concave shape. If you held a tiny drop of water on the nail, it would sit there instead of rolling off. This is called koilonychia, spoon nails, and the message it carries is almost always about iron, specifically iron deficiency anemia, when the body has been running so low on iron for so long that the nail tissue literally does not have the structural material it needs to form properly, and it begins to deform.